Hello, everyone. Good afternoon. Good morning to some of you, depending on where in the world you are. These virtual events. My name is Justin Knight, and I serve as Director of the Office of External Affairs here at FEMA, and I'm so thrilled to be moderating today's panel. Our very quick discussion today aims to highlight the best practices and real-world examples of equity in action. Through the experience of and leadership of our panelists, we will explore the work of advancing. Hello, everyone. Good afternoon. Good morning to some of you, depending on where. Okay, a little technical difficulty there. Real-world examples of equity in action through our leaders of the panel. We'll explore how they've been able to advance equity in their organizations, not only in the recovery phase, but the full life cycle of a disaster. As we together build a more disaster resilient nation, equity is more than just a word that's being used a lot right now, right? We're hearing the word a lot, buzzword, as our administrator says, but it's more than that, as Administrator Chris Grell also says, that equity is actually a call to action to improve the effectiveness and efficiency of our disaster preparedness, mitigation, response, and recovery. This is especially true for communities that I say are often those that have been shut out, put out, or forgotten. So with that, let's meet our panel. These three thought leaders will share with us today some of the best practices and perspectives that will help all of us think a little differently and more effectively of how we advance equity. First, we have Dr. Nicolette Louis-Saint, who serves as Executive Director and President of the Healthcare Ready, a 501c3 organization that focuses on strengthening the United States' healthcare supply chain preparedness response before, during, and after natural disasters and pandemics. Next, please meet Dr. Sylvia Bartley. Dr. Bartley is a lifelong seeker of spiritual enlightenment and inner peace. I love that. She strives to hold these values in all aspects of her life, both as a senior global director of Medtronic and in her community service work to help eliminate economic, health, and educational disparities in Minnesota. And finally, but certainly not least, we have Mr. Brooks Nelson, who is the Senior Manager for Community Resilience at Walmart.org, where he leads philanthropic disaster preparedness and response, working with partner nonprofits, operators, associates, as well as Walmart's international markets and customers. We don't have a lot of time today, so we've captured questions that gives our panelists the ability to speak to their experiences and shine a light on perspectives that will help all of us, again, advance this work. And so my first question, of which I'm going to ask all of our panelists to give 2-minute remarks, please ground us in your experience. How are you currently working to build resilience as leaders in your organizations? And Dr. Louis-Saint, please kick us off.
Sure. And I just want to say thank you for having me, and thank you for having such an important conversation. We'll do my best in 2 minutes. So building resilience in our organization, really interesting that you asked that at this juncture, because if you think about where we are a year and a half into the COVID response, I think, resilience can mean a lot of things, but first and foremost, what it means for me is making sure that I'm taking care of our organization in ways that allow for us to take care of our people, allow for them to be able to be resilient in the ways that, frankly, they should not have to be, but they have to be at this juncture because of how hard they've worked over the last year and a half, which also means their ability to only fulfill their mission if they can fulfill their ability to take care of themselves and their families first and foremost. So that is paramount to me in building resilience, is that our mission really depends on the shoulders, the minds, the hearts of the people who are in the organization and have to carry that out and can only do so when they're taken care of. I think beyond that, what it also means for us is that we have to look at the communities and the populations that we serve from a value-based perspective, understanding that they have inherently within them knowledge, capacity, ideas, energy that we need to make sure that we are incorporating into strategies that will help them absorb shocks and recover from stresses, and not viewing them from a deficit model, which would suggest that we need to parachute in, provide them with things, and then step away, which is not resilient or sustainable from our approach.
No, I'm totally tracking with that, and thank you for those remarks. Dr. Bartley, let's go to you next.
Yeah, and thank you very much for this opportunity to be on this panel as well. And I will follow Nicolette and say the same. I work for Medtronic, a medical device company, and our mission is really focused on alleviating pain, restoring health, and extending life. And through our work, we treat over 70 conditions in the human body, and our therapies really do address these chronic conditions. And we're a true global company operating in over 150 countries. So when I think about resilience from the Medtronic PLC side, we really do focus, just like Nicolette says, on employees first, making sure they have what they need to do to be whole, to be safe, and to really work and be able to live their lives the best that they can. And part of that, of course, is ensuring that they are able and well positioned to help our communities as well as our patients. And of course, we put our patients front and center of everything that we do. And because we are dealing with patients with chronic illnesses, we've got to make sure that they have what they need to survive during normal, in parentheses, conditions, as well as conditions after a disaster. In the Medtronic Foundation, where I work, overseeing our employee engagement and also overseeing how we respond to disaster response, we work with our strategic thought partners internally and externally to develop a really robust framework on how we prepare communities for disasters and how we can respond as quickly as we can to impacted communities after a disaster has occurred. And part of our resilience plan is to really leverage one of our most precious treasures in Medtronic, which is our employees. And we work with nonprofit organizations to curate volunteer programs so that our employees can hit the ground at the appropriate time after a disaster, such as Hurricane Maria and Harvey, and work on a very, in a very processed way to really help build and strengthen communities and healthcare centers. And our plan is not just in the relief, it's also in the long-term recovery as well. So we're very invested in helping the relief and building resilience, particularly in healthcare systems around the world.
That's fantastic. Thank you so much for sharing. And with that, Mr. Nelson, over to you.
Sure, thank you so much. So over the years, Walmart has been intentional about leveraging our strengths and associates and other resources to help support and build resiliency in communities. And while Walmart has always helped communities in times of disaster, the experience of Hurricane Katrina helped us realize how we can best draw on our strengths to support relief efforts in the aftermath of disaster. And similar to my fellow panelists, we really focus on our associates first, our store operations, so that the community can get in and get the supplies they need, and then supporting the community. And our philanthropy has evolved since Katrina and aims to improve the entire systems, not just respond in the moment. So as such, we focus on both disaster response and disaster preparedness efforts. We take a shared value approach and look for opportunities where our investments, operations, and in-kind support can unlock barriers and open up possibilities for further capacity building. So since 2016, Walmart, Sam's Club, and the Walmart Foundation has provided more than $108 million in cash and in-kind donations to support the community preparedness and relief efforts for disasters. So two examples I just want to highlight of these recent investments, especially supporting equity in disaster response, was through support to two existing grantees. Recognizing the need to recruit and create more culturally diverse community response teams to better serve and engage underserved communities, The Walmart Foundation supported the Salvation Army to partner with IDIM to develop a new training curriculum for existing volunteers, as well as train leadership staff to create an equity-based program for recruitment of new volunteers and individuals. Additionally, the Walmart Foundation recently invested in new programs like support through SVP's Leadership Practitioner Training Program, which helps build resilient communities through training state and local government leaders and practitioners whose job it is to ensure federal funds reach the most vulnerable people in a timely manner. This training not only helps practitioners identify underrepresented communities who need the funding the most, but also helps increase the speed at which these funds are allocated. So these investments, among many other of our support, is just continued effort to help communities build resiliency and respond more effectively and equitably when disaster strikes.
Thank you so much for that. And as we think about all of our organizations, the roles that we play in the community within such important work, we also have responsibility to those communities that, as I said before, those often shut out, put out, and forgotten. And so as we think about equity specifically, and most of you connected to that in your remarks about how you're advancing this idea of resilience in our nation and with our communities and with our organizations, wanting to drill down specifically in today's topic, which is equity. And I have a two-part question for you. The first part is, how are you using equity as a lens to advance change in your organizations? So what does that equity piece look like? And the second part of that question is, what are the barriers you're experiencing? I think sometimes we try to just oversell the wins and the successes without specifically talking about the barriers, because that's where the true change happens. If equity was something that was easy, we wouldn't be talking about it right now in 2021. So I'd love to hear, again, the lens in which you're using equity and the barriers that you're experiencing and how you're addressing that work. And let's go back the opposite way to be equitable in our remarks. And Mr. Nelson, let's start with you.
All right. So, I mean, we work toward advancing diversity, equity, inclusion across all of our giving portfolios. We aim to advance solutions to bridge divides and help work toward a world in which all people have equitable access to tools. And that remains especially true as we respond to disaster and consider our investments for preparedness. We look at vulnerabilities within the community. We look at the access to services. We look at socioeconomic factors, and then we also ensure racial equity as we're thinking about the lenses from our framework. Like many of the companies and partners on today's conference, we've been very engaged in the response to India's recent COVID surge through donations of oxygen plants, cylinders, containers, concentrators. And so using that equity lens, we worked very closely with our partners, AmeriCares and International Medical Corps with Doctors for You, to ensure that where those supplies were being placed were being done in an equitable way, and really thinking about rural populations and health disparities and where we were in the hospitals that we were selecting for that. So to be able to apply that, we rely very heavily on our local markets and our local partners. That information is extremely helpful, but it can be a barrier in the speed of the information that's provided as we're trying to make decisions very quickly. And then another barrier is knowing who the local partners are and who are meeting those needs of the communities and reaching the people that we're trying to serve.
I appreciate that. Let's go over to Dr. Barkley.
Yeah, thank you. So I'm going to talk from the Medtronic Foundation perspective. In Medtronic PLC, we have a very deep and impactful diversity, equity, inclusion strategy that we've been working on for many years, and it's come to fruition, particularly with the aftermath of George Floyd's murder. And that really is becoming embedded in the fabric of the organization and how we work. Now, when it comes to the foundation, we are also applying an equitable lens in the way that we do our business. And so if I focus just on disaster response, as you know, disasters exacerbate wealth inequalities, and there is a national a research study to provide data to support that. And we know the economic burden of the pandemic and the rude awakening of the racial inequities triggered by the public lynching of George Floyd. Equity, and particularly racial equity, is at the forefront of most business strategies. And when I was preparing for this talk, I read a McKinsey article that noted over $2 billion have been committed to addressing racial equity, and how these commitments will contribute to systemic change that's required to eliminate the inequities. That is yet to be demonstrated. And it's a very difficult thing to do. And so in the foundation, we are really applying our equitable lens to make sure that our partners who we do business with, that we have at least 50% of our nonprofit partners are diverse. And by diverse, I mean we're looking at the board level for diversity representation, at the senior leadership level in the organization, together with the communities that they serve. And then we really want to focus on lifting up and serving those most vulnerable, underserved populations throughout and after disaster, and in all of our programming. And we're working with really good nonprofit partners and selecting them in a very inclusive way. And what we're doing that is very new since all of this change over the last 18 months or so is really involving employees in our partner selection, bringing their lens and their experiences and know-how into the process to make sure that we are considering all the organizations, because we don't know everyone that's out there, but considering all the organizations, particularly the diverse ones, and working very closely with our networks and our ERGs to make sure that we've got the right representation and working with the right organizations. And that's been a big shift in how we select our partners and working very more closely with the ERGs in how we execute. Now, when it comes to the barriers, and yesterday we had a pre-session to talk about this with peers in the industry, I think the barriers are quite common across the industry. When we talk about working with diverse partners, you hear, this is a new space. We don't know who they are. We don't know where they are. Do they have the capability? Do they have the capacity? Do they have the reach? Do they have the scalability that we would want to have with a strategic partner, particularly when it comes to disaster response? And so, and companies like working with their existing partners because they've built trusting relationships, and that's very understandable. But the smaller organizations, which typically tend to be the diverse organizations, they're not even considered sometimes. And this is the barrier that we really have to address if we want to move the needle. Because as Nicolette says, we don't want to start this from a place of deficit. We want to start it from an asset base. These communities have lots of information, lots of treasures, lots of skills, lots of knowledge. They just need the agency to do what they know they need to do for their community. So we should partner with them from the very beginning and really help deliver our strategies and our focus on helping to eliminate disparities, particularly when it comes to disaster response. And I think that's our biggest challenge, really working outside of our comfort zone and just doing the work that it will take to work with these organizations and help them build capacity and do what they need to do to work in their communities.
So fantastic. And finally, let's go over to Dr. Lewison.
Sure. So I think on the equity lens, I would echo so much of what was already said, but I think for us, we look at it both internally as well as in the work that we do. And I think so much of the lens also exposes the barriers. So we look at it from the vantage point of what does it look like to have an equitable and a diverse team? What does it look like to view equity, diversity, and inclusion as a continuum, which means that our job is not done just because we're diverse, but we actually have to maintain an inclusive environment? How do you carry that out in your work? How do you carry that out in your salaries? How do you carry that out in how HR rolls out? How do you carry that out in your programs? And so when you start to think about the programs, if you look at the traditional emergency management life cycle, it actually gets really tricky for us as a nonprofit organization, if I'm being honest, because it's difficult to fund equitable work in preparedness. It's difficult to fund equitable recovery. And so when we are often thinking through how to maintain equity in all of the work that we do, sustainability and funding is actually a very big challenge. And I'm actually really proud of the ways in which our funders and partners have leaned in and have understood that it takes different sets of metrics. Sometimes you're planting the seeds and generations later, we will be able to enjoy the shade. But we do have to understand this idea of the investment is different. If we're really talking about resilience, it means that equity has to be in every stage of the programs that we do. And oftentimes we're struggling with how do you make a cleaner tie between community level investments and mitigation and preparedness, investments that may happen to absorb shocks and stressors in response, and then thinking through recovery in an equitable way. And I think often recovery is the part that is forgotten. And that's really where we think there's a huge opportunity to move the needle at the community level.
Thank you for that, all those remarks and that perspective. I was writing notes as quickly as you guys were talking to try to capture all that thinking. Want to ask one more question before we go into our close. You know, our administrator, Chris Will, is very focused on this idea of the full scope, the full system of emergency management, and that definitely includes our faith-based leaders, community-based organizations, and as well as our nonprofit and corporate partners. And so, in thinking about the role that you all play in a disaster before, during, and after. And to all those listening and watching this panel right now, what are some suggestions that you would offer for those that maybe haven't grappled with equity before? Whether it's data, whether it's making sure the workforce understands the definition of equity, whatever that is, just a couple of perspectives would be great. And let's keep the remarks to a minute because we're getting short on time. And to kick us off, we're going to go with Dr. Bartley.
Thank you. I hope you can't hear the storm here. The slides have just opened up, so excuse the noise. But I would say this, look, I think we've got to work differently. One thing COVID has taught us is how to reimagine how we work and how to reach people that we don't typically reach. And so when it comes to diversity, particularly in disaster response, I would just encourage everyone, one, to collect data on who are they funding and where is this money going, and collect that racial data as well to see which communities you're impacting, because we are lacking data in that space. Then secondly, work with different organizations that are community-based, that are rooted in the communities that are most vulnerable and that are most impacted by the barriers that we just spoke about earlier. And find them, work with FEMA. They're doing civil, I think it's called civil rights summits, where they're bringing these communities together so we can listen and learn, and then introduce them to organizations that are looking for partners like them. So do things like that that are very different and really work to get to those communities. Secondly, work with your existing partners, and if you're not already, be directive with them. Tell them, you know, we would like to work in this population, in this region, and put some metrics down in the grant agreement before you enter into doing work with them, before you distribute grants. So it's very clear on both sides. And we do this in Medtronic, and our partners are more than happy to work with us and provide us with that information. So we're leading with impact, and we're being very directive as much as we can on the communities that we serve. And I'll stop there, but thank you.
Thank you so much. Mr. Nelson, over to you.
Well, just given time, I mean, I think Dr. Bartley summed that up perfectly well. Much of what I was going to say was very similar. Work with existing partners, but look for new partners, and just think about how unlocking additional financial resources for some of these underserved communities who may not have access to those is also critical.
And being mindful of time, we have just a minute left, so I'm going to ask Dr. Louisant to close us out with a call to action for the group and how we can think about what to do next.
Sure. Thank you. And again, thank you. So I would just say in 50 seconds or less that we have seen due to COVID that when we think about vulnerability, when we think about the ways in which disasters or catastrophic events can impact us, we should recognize that that actually means all of us. So when we're thinking about equity, it is not about us versus them. It's not a zero-sum game. It really is about how we consider the ways that we all tie in and that we can lock hands and understand that every part of our society and all of the strategies that we roll out will have to be equitable if we are going to make it through this generation and all of the challenges that we think are going to face us in the near future. And so from my vantage point, I think there's an opportunity, but we should be thinking about this as a beginning and not an endpoint. Thank you.
Thank you so much. Thank you to our panelists. Thank you for this conversation. The time we had wasn't nearly enough to navigate the complexities and the critical urgency around equity, but the words and the pearls of wisdom you gave us today put us off into a really good path forward. So thank you for your brilliance, your minds, and your passion.